Hi everyone, welcome back to my channel. So if you haven't watched sort of the part one of this, please go and watch it. I don't know what the title is going to be because I'm filming these back to back. It'll be probably something like where I'm at. It's going to be one of the videos with the same background, but I'm going to upload that one first. That will set the scene and it will tell you guys where I'm at and what I'm doing. I'm getting medical treatment in another country, so I'll just say that. And I ended that video talking about a gentleman that is also receiving treatment at the same clinic that I'm getting treatment at. And I'm sort of having like an existential, I don't know if it's like an existential crisis or what is going on, but it was something that just really struck me. So this morning I had a treatment. I had an IV that I needed to do as part of my treatment. It's been basically every single day, Monday through Friday, getting treatments. I'm here for about a month, so it's going to be, I think, like 14 days total, 14 or 15 days total of just treatments, different types of treatments, back to back to back. So, but they treat a lot of different conditions, and you'll see in that previous video that I did not expect, even though I know that they do treat cancer in this clinic, I did not expect that that was going to be his diagnosis. He was very thin, he's very frail looking, he looks kind of like me, just very bony, very skinny. And his wife was there, and I had actually seen him once before, but his wife sat next to me, and everybody was in a chatty mood. There were a lot of us there this morning. And if you see my previous video, his diagnosis is pancreatic cancer. So a lot of this kind of, I don't know, for like I said, for whatever reason, I did not anticipate that that's what his diagnosis was. I'm not really sure what I thought his diagnosis was. But basically what they had, the decision that they had come to, him and his wife, was that he wasn't going to do any more like chemo or surgeries. I think he had already had one surgery, and obviously that didn't go well. And so they were deciding to go with something alternative. And they actually live out here. So she's from here, I'm in Puerto Vallarta, Mexico. She's from here, and he's actually Canadian. And so they got married, and I guess they came to live over here. And there are actually several alternative medicine clinics in the area, and they all seem to specialize in alternative cancer treatments. Now, I'm not going to go into the controversy over alternative cancer treatments. There are some people that have had really good luck with them, but if you know anything about pancreatic cancer, you know, I think they realize, you know, just from talking to them, I think they both well, I didn't really talk to him. He really wasn't talking to anybody. But speaking to his wife, I think there is this sense of understanding that this is kind of like just a shot in the dark for them. You know, probably everybody in the world knows what a diagnosis of pancreatic cancer means. And I knew as soon as she told me, I was like, oh, you know, I don't know. It felt like a slap in the face almost. I was like, oh my God. So, you know, anybody that hears that, we all know what that means. We've seen all the celebrities, you know, Patrick Swayze, the guy from Apple, I always forget his name, Steve Jobs. So many famous people that we've seen deal with this. And we know what the end result is going to be. And I finished my treatment for the morning. I was the first one. There was another lady there recovering from cancer treatment, recovering from her chemo. And then there was another woman there that said that she had a tumor on her kidney. So it was kind of weird to be sitting in a room with three people that have either cancer or suspected cancer or had cancer. You know, going into this thinking to myself, I've got it the worst, right? I've got it the worst out of everyone. You know, the lady recovering from cancer was like a super chatty Kathy. She was just like friendly. She was like singing and, you know, doing all kinds of stuff. The other lady with the tumor, she was also like very upbeat, and, you know, she was just like, I'm not going to do the surgeries or the chemo or anything like that. And then seeing this gentleman there, and, you know, even when I look at him, I was like, you know, I feel your vibe. I had seen him once before, and I remember seeing him, and he was just like, you know, you could tell he's not happy. He doesn't talk to anybody really. He's just not having it. That's kind of just sort of how he looks. And I don't know, I feel his vibe. I was like, I feel your vibe. I get you. Like, I get how you're feeling. Or at least that's kind of what I thought until I found out what his diagnosis was. And this sort of threw me into this, like, oh my God, right? This existential, you know, because I sat right across from him. I sat across from him, and I sat next to his wife. And I don't know, it just hit me. And all of these different thoughts, you know, came to my mind. And especially after I left, I was the first one to leave. And I was like, you know, I'm sitting across from someone who is probably dying. I actually started Googling pancreatic cancer, and basically the end stages are, you know, when they're already losing a lot of weight, they're not eating much. I think his wife brought him some food. He ate a little bit, but he is he looks very, very thin. And so, you know, I started reading about that, and I was just like, oh my God, you know, this is just so tragic. I think they do have a full understanding of what their odds are. They're doing this, you know, and also too, I know, like I said, I'm not here to talk about the controversy. I know there's going to be people that are like, this is dumb. Why would they do that? But when it comes to other cancers, yeah, I would be like, I don't know if I would go with the holistic route. You know, like, I don't know if I would play that game. But I think with something like pancreatic cancer, I don't think it really, you know, I don't think it's going to make a huge difference whether you go the chemo route and all of that, the traditional stuff, or alternative stuff. You know, your chances and your odds are probably the same either way. And so why torture yourself? And I think that's the conclusion that they had come to, and the decision that they made together, that, you know, why is he going to put himself through all of this, more surgeries, more chemo, aggressive treatments, when he could just not do that and maybe try something else and, you know, pray for the best. And I think with a diagnosis like that, yes, those are the decisions that that you have to make. And probably the best decisions that you can make, because you're only torturing yourself, you're only hurting yourself more in the end. And it seems like he's sort of realizing, or he's reality is there. You could tell by the look on his face and just the way his demeanor, he knows, he's aware of the reality of things. He may not be happy about it, but he may not have accepted it yet, but he is well aware of the reality, and I think she is as well. And she was very positive. She was like, you know, we're hopeful that these things will work. She says, you know, a lot of these things are newer treatments. They're already doing this stuff in Europe. And so I was like, hey, you know, if that's his wish, if his wish is to do these types of treatments instead of, you know, going the traditional route, then I think, you know, that should be honored. But to sit across from him, and once she told me what his diagnosis was, and I started thinking to myself, you know, here's this body sitting across from me, right? What must be going through his mind? The terror, you know, the terror of, he's still alive right now. I don't know, you know, when he was diagnosed, but I know that this is a type of cancer that is very fast moving. And like I said, he was already very thin, which is apparently the end stages. And I think to myself, imagine sitting in an IV room with other people. Me, I have Lyme disease, and they asked me what my diagnosis was too, because we were all sharing. And so I was like, yeah, I have Lyme disease, or complications from Lyme disease, autoimmune, that kind of thing. And so he must be sitting there like, oh my, like, what? Like, because people have a very different perspective of Lyme disease. And so I kind of felt almost like I was being insulting to him, sitting across from him being like, yeah, I've been sick for a long time. And then he's probably thinking in his mind, like, I'm dying. But that brought a lot of things to my mind. There are a lot of people with chronic illness that say, I would rather have cancer. I would rather have cancer. I don't think that's a good thing to say. I know I've done a video on this before. I don't think that's a good thing to say because really it depends on the cancer. Some cancers are very curable. For example, like my nephew that had leukemia, 3 years of treatment, and he's good to go. A lot of breast cancers are curable, things like that. But then you see someone like him where, it's this cancer that's very notorious, right? We all know what it is and we all know what it means. And I sat there and started thinking to myself what that must feel like to get that diagnosis, to be sitting in a room with other people, one that just finished her chemotherapy and appears to be, I guess, doing well, another woman who's maybe got cancer, maybe not, and then myself. And one of the things that came to my mind, because I always, a lot of us, like I said, a lot of chronically ill people say, I would rather have cancer because at least people with cancer get sympathy. But I think the difference, there's a big difference between, I think people with cancer and people with chronic illness. And there are cancers that are chronic as well. So that's kind of where that overlaps. But it started to dawn on me that people with cancer, especially that kind of cancer that's very sudden and very quick, you had a life and you have a life. You haven't been sick for that long to lose your life, right? He's probably been only, and as I mentioned before, people have sympathy. So you don't lose friends, or if you do lose friends, you lose them and everything happens, everything happens within such a short amount of time that it hurts a lot because you have your kids, they have kids, they have a business, they have, things that they've been doing, right? And within a very short period of time, all of a sudden your entire life is you're in the middle of things. And I think that's where cancer differs from chronic illness. With cancer, you're in the middle of things, it hits you, and you're just like, but I have this that I still needed to do. I have this that I still needed to. I still needed to finish raising my kids, or I still, haven't seen my grandkids. And suddenly this thing comes in, and that becomes the focus of your entire life. Whereas with chronic illness, we go years and years and years, and you lose everything, right? Over the years, you lose your spouse, you lose your money, you lose your home, you lose your family, you lose your friends, you lose everything. And I think that's why a lot of people with chronic illness are just like, well, I would rather just die. I would rather just die than be dealing with this because you don't have anything to live for anymore. Whereas a person with cancer has everything to live for. They have a life. Even while they have cancer, they still have this life. And they're just like, well, I'm not ready to go. This just came out of nowhere. I'm not ready to leave yet. And that was a striking difference for me because, I didn't make another video where I talked about the MAID program in Canada and how I've seen 2 stories come out of 2 chronically ill, I believe they were both women, who chose euthanasia over, because they couldn't get access to the things that they needed in order to live a comfortable or somewhat healthy life, a life that wasn't constantly aggravating their medical issues. And, then I see this gentleman and I think to myself, he's very sick and he knows that this is probably there's not a good prognosis. Why wouldn't he choose, if there's any time to use that program in Canada, it would be for something like that. Not for someone who can't find clean housing or for someone that, can't find in-home care. You got to watch that video in order to know what I'm talking about. But for a case like his, it's like, well, but why wouldn't he choose something like that? And that's because people with cancer have a lot to live for. They had everything, and they still have everything. They were in the middle of living life when this happens, because it happens so fast. And I think that's where the difference in perspective happens between people with chronic illness and people with cancers is the fact that we're over here and we're just like, I think to myself, if I was in his shoes or anybody else's shoes, like if I got diagnosed with cancer tomorrow, I'd be like, I don't care, I'm done. I don't want to deal with this anymore. I want nothing to do with this. Just let me go. That's my philosophy. But the reason why I would say that is because I don't have anything, right? I don't have anything. I don't have, a spouse or a job, a career, none of those things. So for whatever reason, it clicked. In that moment, it clicked because I thought to myself, why would he put himself through anything at this point anymore? Why not just be at home and rest? And all of it sort of shifted and it made sense. And I understand now why there is this divide between those of us who are chronically ill and people who have cancer, and why a lot of chronically ill people are just like, oh, I'd rather have cancer. I wouldn't rather have cancer. I was sitting there and thinking to myself, how terrified this man must be, because, if this is the end for him, this is how he's going to be spending his last days, getting IVs, getting experimental treatments or alternative treatments, and praying, hoping and praying that some of it works, but knowing that the odds are against him, big time. And that terror that it's unimaginable to me, and I was sitting right across from him. That was the one thing that I was like, I'm sitting right across from this man, and he may not be here in a few months. And it does put everything into perspective when you know that someone is suffering a lot. When you're in the presence of someone that is losing their life. I have often felt that way myself, like I am dying a very, very slow death. But then I look back at all of the things that have happened to me. I mean, when I arrived here, I was in a flare. I was really sick. And I had been sick for about a month, just having stomach issues. It just wouldn't stop. Endless, just feeling horrible, just feeling very, very sick. And I just did not know really what to do anymore. And I thought to myself, how am I going to make it on this trip? Like, I'm so sick. Like, I can't, I have to get on an airplane and I had to walk up 3 flights of stairs with my luggage. And then I look at someone like that and I go, this guy is doing this. Like, this guy is getting through these treatments. He's just doing it. He's doing it. He's getting through it, and he's here. He's still here right now. On the flip side of that, and this is something that, again, I'm not trying to diminish people who have cancer and say that it's not serious, particularly a diagnosis of that magnitude, that is just so. The outcomes are just not good. But, I've been struggling through some of these treatments, and it was funny because his wife, I think, asked him, and she's like, are you having any kind of nausea because we get vitamin C IVs, and if you're battling cancer, your IVs are very high dosage, where you're looking at 50 grams, 100 grams, very, very high dosage IVs. And I've been struggling to get through a 25 gram IV of vitamin C. I was having a lot of nausea. My stomach was bothering me. My stomach was horrible when I got here anyways to begin with. And then you look at someone, with that type of cancer, just breezing through the IV. There was a woman sitting next to him. She had 100 grams. It looked like this. It looked like a bottle like this that they had put into her. And she was just like, yeah, I don't feel anything. I feel okay. And I'm sitting there terrified because I'm doing a 25 gram bottle. And I'm just like, I hope I feel okay. I hope I don't feel sick. And I've been having a lot of nausea. I've been waking up. I woke up this morning with a lot of nausea, feeling sick, feeling almost like I have like the stomach flu, and just having fatigue, feeling tired. And then you look at these people that are like chit-chatting, like this other lady that just got over a cancer treatment, her veins were like collapsing with some of the treatments and stuff like that. And so it really, I think one of the things that I want to drive home with a lot of people that that sort of criticize those of us with chronic illnesses that don't believe us is that everything is different. I'm comparing apples and oranges, to be honest, in this situation, because cancer is a very, very different beast than a chronic illness. But, on the flip side of that, you see cancer patients that can tolerate some very, very aggressive treatments. And you see people with chronic illness that can't tolerate anything at all. They just can't get through it. And it's a very, very different thing. It's a very different type of illness to deal with. And I know that when my nephew finished his chemo, my nephew had leukemia. He did his chemo. He got through it in like 3 years, finished. He's doing well. He's cancer free. It seemed like everybody turned and looked at me and was like, well, why are you still sick? Like, why are you, like, what is your problem? If he was able to beat cancer in 3 years, if he was able to go through all of those treatments, tolerate chemo, tolerate steroids, and then I felt like everybody just turned and looked at me like you're so full of it. It didn't make people more sympathetic towards me. It made people less sympathetic towards me because they're like, you don't have cancer. So what is your problem? And I think that's where things get very muddled. And I'm not saying that my diagnosis or that I would rather have what this man has. I mean, he is on the very, very, severe end of the cancer spectrum. But, it does put things into perspective, and it should tell people something about the way that these illnesses operate. And I've said this before, chronic illness, people think that chronic illness is not terminal. You do eventually die from it. It just takes a really, really long time. It takes a really long time, or it takes, one little misstep and, your body can't handle it. And so, when people hear chronic illness, they think, oh, you're tired or you're achy for the rest of your life. That's what chronic illness is, right? You're just kind of like, your body hurts all the time, but you're still able to function. Well, it really depends. It depends on the person. Some people are high functioning with chronic illness. Some people are very, very low functioning or fully disabled, bedbound, that kind of thing. I've seen people with cancer that are still going about their lives, doing things, living normal lives. I have an uncle who has cancer. He's going to be on medication for the rest of his life, and goes back and forth from Mexico to the US, and he's living his life, eating the same way that he's always eaten, living more or less a normal life. So it really, I want people to sort of put things into perspective. This situation put things into perspective for me. I thought to myself, this guy is doing it. This guy is giving it whatever he can, regardless of how, unhappy he appears. I mean, he has no reason to be happy. I mean, this is not a happy situation for him. But he's still going at it. He's still like, we're going to try, we're going to do whatever we need to do. They're going to throw whatever amount of money they can at it. And I sit there and I go, he's walking around with this terror in his heart and in his mind, and he's still doing this. He's still trying to continue to move forward. So for me, it was eye-opening. It was, granted, I also don't want people to think that this is, you have to be grateful for your chronic illness. I'm definitely not. I would rather not have it at all. I just have a different perspective, at least for today, knowing what I know now, and now seeing this man, every time I see him, it's going to come into my mind, And I see that. I see that, you know, stories that I hear, the book that I read, if you guys haven't seen that review, it's called The Happiest Man on Earth. Also, someone who has gone through extreme pain and suffering, and it really puts life into perspective. It makes you think about things. It makes you think about your own suffering in a bit of a different way. I'm not saying you should say, you should think to yourself, I'm not suffering as much as this other person, but just think about your suffering differently. And I think that's what happened to me today, is that I'm looking at it in a different way. But anyways, this was a long video. I hope that this may have helped somebody out there, or at least been informative. I will come back and make other videos about the treatments I've been receiving. And yeah, I'll see you guys soon. Take care.